for undergrad, and also didn't know that I was interested in medicine. I also started out interested in genetics, actually. So was just kind of looking for what to go into with that. Was thinking about biotech, was thinking about some sort of industry like that. And then one of my best friends in college recommended that I take an intro to neuro class because I had no idea what I wanted my major to be. And I was kind of running out of time to decide. So I took the just the really basic intro to neuro and really loved it. And then that kind of set me on the path towards medicine. I worked in college as an EMT, so got patient interaction, that kind of stuff, and also worked more on the administrative side of my EMS agency. So got to see um, the more like broad scale healthcare side of things as well. And then let's see, I graduated and went to do a master's program at Northeastern University in biotechnology, which I enjoyed and got me to see the parts of that industry that I liked and were the reason why I was originally drawn to it, but also the parts I don't like and why I wanted to shift that focus more into path in medicine. Um, yeah, and then like Sebastian, I also got in on my second cycle of the application. I also waited too long the first time. That was in part because my undergrad schedule was a little weird and our transcripts didn't come out until well into the cycle, so that kind of pushed things back. So seconding what Sebastian said on be prepared and strategic with your timing and like hold yourself to a schedule is important. And also, I would say with that, it's important to really know why you want to go into medicine. I found that it really came across looking back at my first application that I hadn't figured that out yet. And during the gap year following the first application cycle, I had the chance to shadow some neurosurgeons, and I figured out that I really loved it and that's what I wanted to do. And I think that that interest and passion came across in my application and was why my second cycle went better. So yeah, I think that that's really my big piece of advice is do some soul searching and figure out what is really drawing you to it and then talk about that and show that you really care about it.
Awesome. So, hi guys, I'm Aria. So, compared to Ryan and Sebastian's stories, mine might be a little bit more of like the classic traditional one where from Long Island. So, in high school, I did a bunch of neuroscience research in basic lab setting at Weill Cornell. And I realized how much I enjoyed it. And it kind of built my passion and led me into majoring into neuroscience for undergrad. So, I went to the University of Rochester and I knew that I wanted to be pre-med through it, but that passion for neuroscience never really went away. And then during my time in undergrad, I also worked and shadowed neurosurgeons there. So kind of like Ryan, like that passion continued to build throughout my time. And, everything I saw only made me more interested and made me want to investigate myself. And you have to find those things that you actually want to care about. And you're not just standing there in the corner, like waiting for the time to go home when you're shadowing, which I'm sure we've all experienced at some point. So that was very exciting for me. And then I decided to take a gap year between undergrad and now. And during that gap year, I worked in clinical oncology research just to switch it up and see what other things are out there. And that was a really great learning experience in terms of learning how phase one clinical trials work, the state of research in the country, the state of funding of research in the country. So that was very eye-opening. And then that led me to here at Zucker. And I just want to say I've known Sebastian and Ryan for a full year now, and I didn't know any of those past stories. So, there's a lot of different paths to get to med school, and we all end up in the same place. So it's very cool.
Yeah, awesome. Thank you guys. And remind me, are y'all MS2s now? Okay, perfect.
Yes, we just finished first year in June. So
All right, perfect. So we did have a question, kind of just talking about if you could go back to your first year of med school, what advice would you give yourself to better prepare for residency applications? Maybe you guys could talk about maybe if there's something you could go back and maybe add or change to your first year. That's kind of what you could talk about.
Yeah, I guess I can kick it off since uh, like Arya just said, we're all just finishing our first year, so we're still feeling out the residency application in a couple of years. But I think a couple pieces of advice that I got and tried to follow, and I think I would have followed a little more carefully, is it's okay to not jump in, first Monday of med school and be like, I need to do 10 research projects today. Like, it's okay to get your feet underneath you and not like burn yourself into the ground before your first semester's up. That is, I think, important. But the flip side of that is also I found that it's just important to say yes to different things. So we have a lot of upperclassmen who have projects or who are in communication with current residents, and they just, offer like, oh, we need someone to write up the method section for this paper. We need someone to proofread this, that kind of thing. And just saying yes to that kind of stuff, even if it's not, your dream project, that's the one that you really want to work on and have as like the highlight of your residency application. You just meet people and get to, experience different things and find different paths. Like I was not at all interested in pediatric neurosurgery until I just happened to run into a attending who does that, and now that's kind of where my focus is at, just because it was a kind of coincidental experience I had. So I think that's my two big pieces of advice.
Yeah, falling behind Ryan, I think definitely saying yes when you can and learning how to balance when to say yes versus when you know you're going to burn yourself out is big. One of the neurosurgery residents actually said earlier in the year when we met and we have a meet and greet panel that you can have everything but not at once. So, you have to balance where right now maybe you're the best at doing research and you're falling a little behind on lecture material. And then other times it's 2 weeks before the finals and that's what's going to be your priority. And you're kind of going to like let your projects fall a little bit. And sometimes it's going to be your family and friends and all these other things. So learning, what part of life you want the emphasis of your time to be on in the moment is a really important skill that I don't think you get as much of in undergrad. And then there's also less of, I think, a motivation in undergrad because none of us really love organic chemistry and none of us love physics. And like, there's no like actual passion for most of us behind a lot of those things aside to get into medical school. So it's hard when you feel like you're picking between everything that you actually like and learning, what you're actually going to put your time towards to is a very helpful skill that it will take time to develop, but it's something to keep on your mind so you're more aware of it and you don't fall into just saying yes to everything all at the same time because nobody can do that. No one's superhuman.
Yeah, for sure. That's definitely great advice. Sebastian, you have anything to add?
Yeah, I'd say the most important skill set that I wish I had mastered before getting my first year of medical school, and I'm still working on this, is just organization because you're going to be juggling a lot of things. In our program, we have to, do a little bit of driving to get to different clinical sites. We also have to juggle kind of, it's like every medical student, different classes, different coursework, as well as trying to be competitive for the future residency application. And so that means taking on projects, helping out with this, helping out with that, getting involved in XYZ. And so just being really organized, being on top of your calendar is probably the biggest piece of advice for the skill set you can build right now and in your first year is just being on top of that.
Yeah, for sure. Definitely some learning things that will help our brain turns, when they get there. So there, we kind of talked a little bit about research, kind of mentioned that there's always a lot of questions kind of about if you guys have any advice on how they can reach out and get those research projects. So if any of you guys kind of have your biggest advice for how they can do that.
I can go first this time. Just really quickly. So I went to the University of Central Florida, which was the second largest university in the United States with like 60,000 students. So it was very saturated in the pre-medical space and it was hard to get research. So the biggest advice is to just keep asking, like find the research space that you have some interest in because that's the research that you want to do, therefore the work that you would be willing to do because it's not easy. Sometimes it's not even fun, even when it is the thing that you enjoy. So, but cold call, email, show up to their office hours. That's probably the biggest thing is if you go to their office hours, if they're nearby, that shows initiative. Read their papers ahead of time and say, "Hey, I thought this was interesting." So do your due diligence. Research is It's like one thing that's on the your application, but really like to get involved and to do significant work, you have to have that background knowledge of what the fundamentals are, and in particular of the fundamentals of the person you're trying to work with and learn from. So that PI isn't just gonna like, it costs a lot of money to run a lab, and they don't want to have extra people if they don't need them. They don't want to have extra costs if they don't need them. So you have to show that you're going to be a valuable member of their team, and in order to do that, you have to come in strong. So come in with your fundamentals, read the research, have valuable questions, show initiative, be respectful, and most importantly, be willing to learn. You don't know anything until you're there. You don't know anything, even about the things you think you know. You don't know anything until you're actually in it. Trust me. So that's my advice.
Wait, I'll
Um,
go. Sorry. Yeah, just following up on what Sebastian said, I think building those connections with people is really important. And I know Ryan mentioned this too with our upperclassmen. They're your friends. They should really be your best friends in the research space because they've been here before you and they've built connections. And, they know the doctors who work with who will give you a fast project turnaround versus the doctors that, might give you your own project and that's going to take a few more months, but that'll be worth it for you. And they have, canvassed the space and they know what's there. So listening to them and hearing what they have to say has really been valuable for us, I think. And then also, like Ryan said, like they'll text you for random parts of random projects that, they might need some extra help with, or they might say, what, this is a big project and we should take this on together. So that's also been great. And I think on top of that, going to the next level up, the residents at whatever program you end up at are an extremely valuable resource because obviously they work with the attendings day in, day out, night and day. So, going in, if you're just shadowing and you get to know the residents, it's been like that for me, where then we'll exchange numbers and they'll text me that they have this one project to work on or that there's a really interesting case report for something they've never seen before. And it just ends up folding and becoming something that is really valuable and is a great research experience, especially in your first year if you haven't done a lot of research before then. And I think learning how to make those connections is great because what we know is all similar as first year medical students, and it's honestly not enough in the field of neurosurgery. Like every day, like we go in and learn more when we go in. So who becomes more important, I think.
yeah, I definitely agree with all of what Sebastian Aria just said. I will say one thing that I was really pleasantly surprised about when getting to med school, and I hope this is just, you know, reassuring to everyone listening, is that it's not like trying to find research in undergrad where I'm sure a lot of you had the experience I had of having to really like claw and try and get into research opportunities just because, you're in a school of several thousand people all trying to do the same projects or like all trying to do things. And there's not as much research happening. And I found in med school that the research is there and they're always just need hands on projects. So if you make yourself available and show interest, like you will be involved in projects. I definitely agree with what Arya was saying about the residents. It can be really scary to like start talking to residents, but they're very much like they're only a couple years down the line from where we are, and they remember what it was like, and they want to help the next generation of like potential neurosurgeons along the path. So I think that that's just really important to, get over that first hesitancy of being willing to talk to residents. And the other biggest piece of advice I got actually came from undergrad when I was a semi-professional photographer then, and my mentor told me, um, if your deadline is, 2 weeks to get a photo shoot back to someone, if you get it back in a week and a half, they'll appreciate that. And I think that that's just show that you're reliable and diligent. And if your PI says, hey, can you have this done for me by the end of the month? Like put in a little effort and get it in a little earlier. Um, and I think that that shows that you're reliable and that you're a hard worker and you sort of get that reputation. And then, they pass your name around and someone else has a project and they're like, oh, hey, reach out to Arya, reach out to Sebastian. They're really good and they'll like definitely follow up and make sure it all gets done on time. So just yeah, I guess really work hard to tailor and maintain your reputation amongst the people that you're working with. And you don't have to be constantly out to impress, but do the work and show that they can count on you.
Yeah, for sure. I thought it was interesting, talking about getting over that, I guess, initial fear of talking to residents or even talking to a PI or even reaching out for shadowing. Um, I think it'd be interesting if y'all could kind of talk about what helps you kind of get over that initial fear, like maybe something that you have to tell yourself or how they can kind of go with that with confidence.
Sure, I can get us started on that. I think when you're going in and you've made the decision that you're trying to explore any specialty and you're deciding to shadow, having some general background knowledge is super important, especially when you're a medical student. There's a certain new expectation, even if you're 1 month into your first year, that you know something. It's not, I think it's a very big change for me from undergrad, where you're more silently in the corner, no one's really asking you questions, and there's no expectation out of you. Is that the second that your title becomes a medical student, there is an expectation that you know some level of something. It doesn't have to be perfect. You don't have to be anywhere close to an expert in the topic, but like a general understanding is very important. And I think also in medical school, I don't know if Sebastian, Ryan, you agree, but you do realize there are such things as like a stupid question or a silly question, because when you're talking to people, I think Sebastian or Ryan mentioned this too, like you ask good questions, ask meaningful questions, because if you ask a question that's an easy Google search away, it seems like you didn't really care enough to put in the effort to look into that before, or even when you're there, just pull it up on your phone, whatever question it is, that maybe that'll inspire you to ask a different question in the same topic. But, there isn't, it's not just like ask the first thing that comes to your head anymore. It's, you really want to know what is making you ask that question. Like take a few steps back and make it a little bit more meaningful, I think, super important. And they'll appreciate that more, and it'll spark up a discussion that will be more beneficial for both of you.
Yeah, I completely agree with that. I think, one thing we hear a lot in our program at Zucker about is first order versus higher order questions. And I think that that's something that I've definitely found, especially when you're shadowing in the OR. It takes time out of their schedule to answer your questions. So if you show that it's something like, oh, I'm watching you do this maneuver. Why? Not just like, oh, what's that called? Or what's that art? Like something that's like Arya said, very basically Googleable, is not going to show that you're really absorbing like what they're either showing you or telling you. And I think that just showing that you're processing it and taking it to that next level of, okay, why are you doing this? How are you doing this? Those are more meaningful questions that I think show that you care about what they're taking the time out of their day to teach you. But then also at the same time, kind of like I was saying earlier, is just that residents are not that much farther down the line than we are. And I think there's definitely a big gap that I've noticed between, even chief residents and attendings, even though they're much closer together than we are to the residents. I think there is that sort of, the attendings are established and they've gotten themselves to that point in their life and they're just in a different headspace than we are. And the residents are very much like, oh, I'm here. I made it to this residency. This is really cool. I want to show you this. I want to tell you about this. So I think just remembering that residents and attendings are all just people, and obviously you have to show like the due deference and respect to their position that they've attained that, we'll hopefully all get to at some point. But at the same time, they're not actually, you know, these terrifying figures who are looking down on us, not wanting to talk to us. They do want to have the next generation of neurosurgeons be people that know what they're doing and that they contributed to that education. So just being willing to receive that and not be, terrified of every word they say is tough to do, but good to remember.
Yeah, I guess the last thing I'll add, because that those are all very well said, is that your comfort in asking people for questions and opportunities will come from the experience of doing such. So, the experience of talking with people, whether they're attendings, whether they're residents, your comfort will increase as you interact with these people, because you build a rapport, you got relationship with them, and the more you talk to other researchers and the more you build up kind of your repertoire of like scientific understanding, et cetera, whether it's clinical research or bedside research, you'll become more comfortable because it's more natural for you to build up or start a conversation. So if you're afraid to ask for something, then the thing you should do is ask so that you get that experience. And I know it's a little counterintuitive, but that's a little bit of a cognitive behavioral therapy for you. Put yourself in the uncomfortable position to improve the comfort over time. So, scientifically backed piece of advice.
Yeah, for sure. I definitely it kind of goes with the whole like you never know unless you do it kind of thing. It's kind of talking about that, I guess, since Sebastian brought up therapy. um, during your pre-med journey, how did you guys deal with lack of motivation and stress?
I guess I can go first because this will be the last question I answer. I have to leave, unfortunately. How did I deal with stress? I am notoriously bad at dealing with stress. Just being fully transparent. I will eat my stress away. I will exercise my stress away. I will do both sometimes at the same time. Um, what again? This goes back to the first thing that I answered, and like the skill that you can develop now is to be organized, and that organization and process will definitely ease the stress. I come from a family of chronic stressors about everything. I get it from my mom. I already know. But being organized and on top of things relieves that stress. So that's one thing you can do is just get on top of it beforehand before it gets on top of you. So anyway, it was a pleasure. Goodbye, everybody.
Thanks for
Have a
joining
great
us,
rest of it.
Sebastian.
Yeah. Thank you. Bye bye.
Yeah, so I agree with what Sebastian was saying there. And one thing I will say is just like find things you like, both in school and out of school. And I say that we had a block earlier this year that was about um, metabolism and GI stuff. I can't stand that. I'm so bad at it. It doesn't click. And I was so stressed the whole block. And that's okay because in school, or I guess next to school, I was, starting to do some neurosurgery research. I was starting to like shadow and find things that I really liked to keep me motivated through the things that I know I don't like. And I know I'm not going into that later, and that's fine. If no one's going to go into med school and specialize in everything because you can't do that. And you have to like, even if you don't know what it is yet, you'll find things you like and things you don't. And just making sure you sprinkle in the things you like during the things you don't keeps it fresh why I'm doing this, which I think is really helpful. And then also just it is, the most cliche piece of advice, but taking time for yourself to do things that you enjoy doing that's not academic is really important. I found that it was really helpful for me to really block myself time because I'm one of those people that doing work will take the amount of time I give it. So if I gave myself, you know, I'm going to work really hard for 2 hours and then I'm going to go out for a run for an hour, or I'm going to go into New York City or do something else that I really want to do this weekend, as opposed to being like, oh, I'll get these flashcards done over the whole course of the weekend. It will take the whole course of the weekend. So finding things you want to do to motivate you to get through the things, again, that you don't necessarily want to do, is a good way that I found of dealing with the stress.
Yeah, I 100% agree with what Sebastian and Ryan said. I think that if you're interested in medical school and entering medical school, stress is going to be a part of who you are for the next 4 years and for the foreseeable 3 to 7 years after that and beyond. So I think learning how to cope with it early is super important. I think that, like Ryan said, having your hobbies, having things that keep you motivated is great. And then also knowing what makes you stressed out is really important to find out early. Like for me, being behind or feeling like I don't have enough time stresses me out. So I know that if I just start early, I won't be stressed out. Like stress is it's necessary, but it's an avoidable thing. So if like Sebastian has figured out that being unorganized stresses him out. So getting organized helps him be less stressed. Like there are ways to deal with it instead of just accepting it for what it is. And there's ways to cope with it. So I think learning what are your, I guess, like triggers for stress or like what is going to make you the most amount of stress is really important because you can avoid that. And each block is a learning experience. Everyone comes into this as their first time in medical school. So people also might seem like they have it more together than they do. And just knowing that we're all on the same page and not to compare yourself to other people, I think is very important because I think it's stressful going into a new atmosphere, not knowing what to expect. But we're all human, whether we're medical students, residents, attendings, and we all have our flaws and our stressors and our issues. So just having patience with yourself, I think is super important.
Yeah, for sure. We kind of talked about that too, of like the whole comparison thing. Like, I think that's the hardest struggle for a lot of pre-meds, meds, like even like non-medical people. Kind of going along that, I know a lot of the times, sometimes people can kind of feel guilty if they're not studying. I'm not sure if that's something that you guys have experienced where you're like, okay, like I'm gonna go try to do something fun, but like in the back of your mind, you're like, oh, I should be doing my Anki cards or I should be studying for this. So if you guys have kind of experienced that, maybe you guys could talk about kind of how you get, I guess you ease that guilt, and just how what that's been like for you.
Sure, I can go. I think that's a real reality for every medical student ever because, like Ryan said, there's no finale. Like you can give yourself as long as you take with any task you do, and there's never any point where you will complete your to-do list. And that starts from day one. If you try to feel good about yourself and say that, okay, I want to finish everything I have to do, that will never happen for you. So I use, Notion to organize what I want to do for every day, and they're in check boxes. And when I'm done with that, then I feel good and I feel like, okay, like I finished what I set out to do. And making sure that every day I'm not giving myself an unrealistic expectation of finishing things that are going to take 2 hours each, because that just won't happen for me. And knowing that if you set yourself up for like a within a realm of reality kind of tasks per day, that'll be better. I think also just like surrounding yourself with people who have the same mindset that school isn't it's important, but it's not everything. Because I think if you're with people in medical school who are always stressed all the time or they're always trying to study, then that sorry, that ends up rubbing off on you. And I think like that will affect your interpretation of reality and the amount of time you're spending maybe like going on runs or cooking or doing things you actually enjoy. So building a circle around you of people who are on the same page as you, whatever page that may be. There's no right or wrong page, but just, having that support, I think is very important.
Yeah, I agree with all of that. I'll add to the part about being realistic is for me, I'm bad at this where I'm like, I have 400 Anki cards due. I'll give myself an hour and I can do this. And then I get to the end of the hour and I'm like, I'm nowhere close to being done. And then I just feel bad about it. And it's like, well, that was never a realistic expectation. So knowing what is setting goals and timing for yourself, I find to be important. But also not not setting yourself up to feel bad at the end of it is also really important. I also agree with like, having the things that you take the time to do that's not school that makes your life better is, like cooking or exercise or things that like, you can feel confident in your head like I did this and I wasn't studying, but I still feel good about it because it was important that I did it. That's also really important. And I also thought that talking to residents and attendings and seeing what their life is like was also very helpful because yes, med school is like, you got to push through it, you got to do a lot to get to that point. But at the same time, you're seeing these people who are actual neurosurgeons going into the OR doing stuff, but they have a life, they have a family, they have, they do things and accepting like if I get myself in a headspace in med school that all I can do is medicine, that's not a realistic expectation for what my life is supposed to look like at the end of this when I, am employed and have a job and am actually taking care of patients. Um, yeah, I think that that's really it is hard to get out of the feeling guilty about taking time for yourself, but also just acknowledging that it's not going to be good for you and you will not perform as well if you don't. And sometimes it might take, that GI metabolism block that I was talking about. I really buried myself in work and I saw that I was not as attentive to my friends and family and they called me out on that. And sometimes it takes messing up once like that to be like, okay, I need to do things differently. And now I think that that actually helped me grow a lot as a student and in managing my time and studying because I know the other people in my life are also affected by me only doing school all the time.
Yeah, for sure. That's definitely some really good advice. We've kind of touched on, Anki and, different blocks that were harder for us. So there's another question kind of talking about what study materials you guys found were effective during your first year. So maybe you can kind of talk about your studying habits or what you found is helpful for you. Because obviously you're learning so much in med school and it's just that saying of you're drinking out of a water hose, fire hose, fire hydrant. So yeah.
Yeah, I can start. I have a very, very mixed relationship with Anki. And you know what? If you don't like it, don't feel like you need to use it. I'm using it to study for STEP right now. I can't use it to study for the material during the year. And I figured that out after the first two blocks of trying to use it and just being incredibly stressed out all the time by seeing in the corner, like, oh, you have 500 cards due. Like, it's midnight. I really don't. Thank you. Um, so I think that that is acknowledge that not everyone's study strategies are going to work for you. So what I'm about to say might not work for you. And please don't think that, I have to do this because that's what the medical students do. Because that's just, like Ari was saying, comparing yourself to others, including other people's strategies, is just not going to be helpful. I personally find it better to just take, a chunk of related lectures and just try and map it out or diagram, like tie it together, show how, we were learning about the synthesis of this hormone over here, like, and how that's all triggered and related and that kind of thing. And then over in this lecture, we were learning about the stimulation for the synthesis of that hormone or whatever, or what that hormone does. And then taking the time after class to put those together and being like, I have A goes to B and B goes to C. How do I make A go to C together? Because just by nature of lectures being, an hour or 2 hours or however long it is, you're not going to get the whole big picture in one sitting. So taking the time to sit down and make that big picture for yourself, I found to be helpful. Um, and then I also found it important when I did use Anki to pick the things that are just rote memorization and not try and, you know, shoehorn in like big concepts into a like two-sided flashcard. I found that not to be helpful, but for things that just I need to see over and over again, sure, that was helpful for me. But I guess long story short is, take the time at the beginning of med school to figure out what works for you, and then just don't let people talk you out of it. Like take suggestions, listen to other people and listen to their advice, but if something's working for you and it's not something that anyone else is doing, that's okay.
Yeah, I 100% agree. I think a lot of people come to medical school and think they need to like reinvent the wheel of the way they study because they think it's so different. But if you're intelligent enough to, do all the pre-med classes, study for the MCAT, get to where you are now, you have to trust yourself that you're going to know what feels right and what feels wrong. So I know for me, like I want multiple passes of the material on like a frequent basis. So I like Anki. I use Anki throughout the school year. And that even that strategy just changes slightly, but I kind of stuck that through. And then I did what Ryan did and took notes and tried to make like a big picture towards the end of every block of what was going on. Because we do have internal exams at Zucker versus some schools have step-based exams. So like there are, these things between schools that also make a difference in the way you approach material. But to me, I knew that that's what was working for me. And if I got through my cards for the day, it felt like, okay, now I'm done for studying. So it's like a numerical value to set expectations to, even when that value became very high. It was just like something to get done and like feel like you're completed, which I think I liked. And I'm very impressed with my classmates that don't use Anki because I feel like their ability to retain that information is so impressive. Like I'll see a card and I'll get it wrong 5 days in a row and I'll still get it wrong when I see it again months later. So it's like whatever works for you, you have to stick to it. And I think a lot of people create their own misery with studying by saying that they have to do what everyone else is doing. And like I think you can very much so create a miserable reality for yourself in medical school if you allow yourself to fall into I need to read the textbook and I need to write out the lecture notes and I want to do my Anki and I want to like talk to the professor. Like you're not going to be able to do it all. So just trust what you've been doing. And if it feels wrong, trust yourself that you'll know what to do to change it.
Yeah, for sure. Um, Kind of, I guess, while we're talking about studying, in terms of the MCAT, if we take the first one for more sort of practice and experience and rely more on the second attempt, will that have any negative consequence? Will the different attempts or numbers of attempts taken be a problem when applying for med school? So I guess you guys can kind of talk about your advice for the MCAT in general.
Sure. We're not sitting on any kind of like student admission committee, so I don't know if we have the most amount of background knowledge on this, but I do know that whatever, however many attempts you take on the MCAT, they're all seen on your application. They're sent directly from the MCAT, whatever application base that is, to AMCAS. So you can't pick and choose what scores you want to send. So if you take it the first time for practice, whatever score that is, every medical school will be able to see it. So as long as you're okay with that, then and just aware of that, then that's like something you should factor into your decision.
I don't know if you have anything to add, Ryan. If not, it's fine.
No, yeah, no, that's more than I knew about the MCAT scoring system. So
Yeah. Maybe if y'all want to kind of talk about, since the MCAT is very much that like first really big hurdle to med school, if y'all kind of want to talk about maybe what your biggest advice for, studying for the MCAT, taking the MCAT is.
yeah, I can get started with that. I will say, like, yes, material is important. Read the Kaplan books or the Princeton Review books or whatever, or however you want to study for it. But the biggest piece of advice I have is it's more about endurance than it is about the material. Like, y- y- you've been like doing the pre-med classes, you're exposed to so much of the material already. So a lot of those books are just review. And then I know they have, if I remember correctly, they're like, little section tests, that kind of thing that, 30 minutes long, an hour long. That's great to test your understanding of the material, but at the end of the day, you really just need to sit down and do multiple days of the 7 hour, this is miserable. I hate everything. I'm not going to eat for the whole time. I'm barely going to drink anything. I'll get 10 minutes to stretch. Like, you have to do that because it's just something that you have to train for. Your body and mind are not used to doing a test under those conditions. And that's like, that's the reality of what it is. So if you can just get over that hurdle, you're already way better off than you were if like even if you didn't know the material at all, but you can physically sit for a 7 hour test and be able to think clearly through the whole thing just because you've done it a few times, you're way better off than you started. So I think that that's my biggest piece of advice.
Yeah, I think the MCAT is more a psychological test than a substance-based test for sure. I think, like Ryan said, no one's supposed to be able to sit there for 7 hours and focus and take that. I think a big mistake a lot of people also make when they're prepping for it is that they'll still be on their phones and like whatever the 10-minute section breaks they give. And like that rewires your brain. You're getting a hit, you're getting good luck text. Oh, you got this text. Like that's not what you really want to be. You're not going to get that on test day. So I think like pre-making your sandwich the night before and eating what you're going to eat that day, like not letting yourself have water or your blanket or, your socks or your phone or anything like that is really important because you have to really actually prepare for what that's going to be like. And also narrowing in on resources because I know like on all these social media pages that every medfluencer or whatever it is like selling their own way of how to study for this and like you're hearing it from your friends too and then you're hearing it from your friends in medical school. I think like whatever you want you have to decide and say that I'm going to stick this all the way through as long as you like it. Like obviously if it's not working for you change your mind, but I think there's too much almost advice out there for pre-med students taking the MCAT and I think that can be really confusing to constantly feel like you're doing the wrong thing or switching up your strategy. So back to trusting yourself I think is really important.
Yeah, for sure. Somewhat kind of switching gears, we're gonna kind of talk about more, I guess, the emotional side that goes in with medicine. So they kind of had a question of, um, obviously, when it comes with medicine, we, especially neurosurgery, you have those patients sometimes with, difficult diagnosis, and communicating that to them, and so they kind of asked about, have you experienced that yet, and if so, what are some ways that you cope or keep perspective, as they are aware that there's emotional side of seeing patients in pain or losing them.
Yeah, I guess I can start. I've seen a few patients this summer, especially since I'm actively shadowing in the OR a couple times a week, and I've seen a few patients where it's like we're doing this procedure and it's going to help them, but at the same time, I've asked my attending, why are we doing this? How much of a difference is it going to make for them? And that was really hard to see, where it was like someone who genuinely we don't know if it would actually help improve their quality of life. And that is tough to deal with, and it's not something that you really are. No person without training or exposure to it is prepared for that kind of thing. You only get not even used to it. Like you adapt to it through exposure to it. So the first few times are really hard, and you might question, wow, how much can medicine really do? How much am I actually having an impact? But I think it is important to remember that at least it helps me that these patients or the families of these patients are, coming to you and trusting you to help. Um, and I think that having that privilege of being trusted and knowing that you are, you know, you're sitting in classes for 6 hours a day and then going home and studying and doing all this to learn, you might remember one drug name that happens to like that might be exactly what this patient needs. You might just absorb the one piece of information that might help. I think is, it's like it's worth it, you know, because it is difficult to see, but knowing that you are doing what you can to learn so that you can help them is comforting in a sense. But also I think finding people that you can talk to about what you've seen is important. Like not necessarily in, a therapy sense, although if that is something that helps you, then, if that's something going into med school helps you deal with hard things, then by all means you should continue that because medicine does, just elevate the emotions of everything you're dealing with, I think. But going to talk to your attending who was with you in that case, or the resident, or other students who have seen difficult situations and being like, hey, I just need to let this out that I'm dealing with this and I am confused about how to feel about it, you'll get advice. That's more situation specific than the blanket like advice we can give you now, I guess. So yeah, that's kind of my advice is remember you're doing the right thing and you're trying your best to help in a situation where something might be out of your control and that there are people around you also dealing with the same thing that can talk to you about it and help you work through it.
Yeah, I think what Ryan was also saying, I think in peds neuro and just in general neurosurgery is that you grapple kind of with quantity versus quality of life of patients. And that's both from the obviously the family end and the physician end of, how many interventions should I do uh, that will still preserve some level of quality of a patient's life versus other branches of neurosurgery like endovascular, if it's a stroke or an aneurysm, you get immediate results. Patients are very grateful, they're very thankful, and like they're very happy with their outcome because they would have died without that intervention. Versus things that are more chronic and have a lot more pro cons to weigh. As a med student, you're let in on those conversations way more than you would be an undergrad. So they're over time you'll build that ability to, not be able to tear up, to be able to control your emotions, to be able to handle things more privately. And that's something that we learn in med school too, of how much should we be sharing with our patients about our emotional state, or if we had someone in the family who's had a stroke or a brain tumor or something, like when is it the right time and the wrong time as a physician to be able to be having those conversations, and when is it helpful versus when does it stray away from the patient's needs. There's a lot of variables I think that play into those difficult conversations, and being a silent observer in them has been very interesting and very has been like a great teaching moment, I think, for all of us who have been able to see it, especially in a field where it is a big dynamic between life and death. And then in medicine in general, like at Zucker, we get EMT trained. So it was I think we do like 5 EMT shifts. It was my second EMT shift. And we're responding to someone who had gone into cardiac arrest, and that patient ended up passing away. It was my second week of medical school. And I think like having the ability to talk to my professors and classmates about that, along with other classmates who had also been on runs where patients had unfortunately passed away, was very helpful. And it made me feel like, okay, like there is a support system for anything I need here. And building that early and with people who are going through the same thing, like Ryan said, is very important because no one should have to go through that alone, or feeling like they did something wrong, or feeling like things could have gone differently without having an outlet to talk about it.
Yeah, definitely. We're kind of running towards the end of our time, so I think maybe the last kind of questions that each of you guys can answer. is kind of talking about maybe what your biggest advice or like the most important thing that you think our brain turn should keep in mind in this journey, whether that be just, the general journey into medicine or, med school related. But yeah.
Sure. I think that biggest advice, like I've been saying throughout this panel, is to trust yourself, to trust that you've made it as far as you've made it because you've been doing the right things and that you're the kind of person that your patients are going to in the future benefit from knowing and being under the care of is really important. While also understanding that you have your own limits and of knowledge and the boundaries that you need to draw because you're a medical student is going to be very interesting and fun balance to figure out as you get there. But to enjoy the journey while you're going through it because it's not a sprint, it's definitely a marathon. And you have to really be able to enjoy, maybe not every day, but every week, every month. You should not be feeling like you're miserable throughout this, even as a pre-med, especially not in medical school, because life goes on anyway. You don't want to feel like you're, 28, 29, 30, feeling like, wow, I don't know where the last 10 years of my life went because my head was in a book. I think you can do both, and finding that balance early is going to be important to still make it feel like you lived a fulfilling life outside of the career of your choice.
Yeah, and I think I fully agree with all that, but also going to what I've been trying to hopefully get across this whole time is finding what you care about. Um, so our career advisor at Zucker, Dr. Miller, he gave us the statistics that like only 25% of people go into med school knowing what they want to do and then actually do it. Like there's a lot of room to move around. And that's okay. Like you don't need to know what you want to do, but you need to know what you care about in medicine. Like why are you doing it? And I know that that's really obnoxious to hear, as I'm sure some of you are either thinking about your personal statements that you're going to write or have already written them, or and like the why medicine thing. Yeah, it's a pain. I am so sorry to bring that up. But it is important to think about why do you care, not trying to like put it into however many words that is, but deep in you, like what about medicine is drawing you to it, and what do you want to do with your career? What patients do you want to help out? How do you want to help them? What outcomes are you hoping to see? That kind of thing. And keep that, like I said earlier, sprinkled in throughout the just class portion of med school where it's like you're not seeing patients every day. You're not getting that satisfaction of, oh, I'm helping someone. You're getting the lack of satisfaction of, oh, I'm learning this biochemical pathway. Yeah, that's not as satisfying. That's not why anyone went into medicine, to just memorize that kind of stuff and have that be the end goal. But keep the keep the parts that are drawing you to medicine relevant in your daily life and just remind yourself of them as hard as it can be that, you're getting there. You're going to get there. And at the end of it, it's all going to be worth it. And find mentors like residents and attendings and like, yeah, learn about their path through medicine, that kind of thing, but also learn about them as people and the life that they have, and that, someday you're going to be that attending who has whatever life you're looking for while treating patients, while, being a mentor to future students and giving them that kind of hope that they're going to get through it. So I guess that's my last bit of advice.
Yeah, no, definitely. These were such great advice. And, we kind of talked about that a little bit, brain turns about, the two big things, trusting yourself and doing things that you're passionate about, not just doing things just to check a box or just to do them. So, even though my advice, it's still relevant and when you're a med student. So, but yeah, so thank you guys so much for joining us. And thank you guys for taking time out of your busy schedules to just come talk to our brain turns. I know that they learned a lot. I surely learned a lot too as well. So brain turns, if we can just say thank you to them. And thank you guys so much for joining.